Today we are delighted to welcome as guest speaker Melbourne Laureate Professor Hugh Taylor, currently the Harold Mitchell Professor of Indigenous Eye Health at the University of Melbourne. Professor Taylor was head of the Department of Ophthalmology at the University of Melbourne and the founding director for the Centre of Eye Research Australia from 1990 to 2007. Prior to that, he was a professor of ophthalmology at the Wilmer Institute at Johns Hopkins University in Baltimore, with joint appointments in the departments of epidemiology and international health. Professor Taylor's current work focuses on Aboriginal eye health. He has led the efforts to eliminate trachoma in Australia and developed the roadmap to close the gap for vision, a blueprint to provide sustainable eye care services to Indigenous Australians. He has worked at the WHO in different roles over 30 years. He has written 36 books and reports and more than 700 scientific papers, and has received multiple international awards and prizes. He is also a Fellow of the Australian Academy of Health and Medical Sciences, and in 2001 was made a Companion in the Order of Australia. He is the President of the International Council for Ophthalmology, Deputy Chairman of Vision 2020 Australia, and was President of the International Agency for the Prevention of Blindness. It is a pleasure to call on him today to speak with us. Please welcome Professor Hugh Taylor.
Thank you very much, Presiding Chancellor. I would like to also recognise the elders of the Wurundjeri people, past, present and future, the traditional owners and the custodians on the land on which we are meeting. Chancellor, again, colleagues, ladies and gentlemen, and particularly you, the new alumni of the University of Melbourne, congratulations. Congratulations on reaching this wonderful day that marks the end of so much hard work and effort. Congratulations for being alumni of one of the world's great universities. Congratulations on completing a major step on your chosen career. And congratulations too to the parents, spouses and partners, families and friends who have supported you and encouraged you through your long and arduous studies. They truly deserve to share this day of joy with you, but this is your day and you need to enjoy it. I'd like to tell you a little bit about how my career evolved. I grew up in Melbourne and trained at this great university. Medicine was a 6-year course then, but at the end of 4th year, the opportunity came for me to do some basic research, an opportunity that was too good to pass up. There I learnt how rewarding it was to find new information, because you really wanted to explore the question and to discover what the answer was. After residency, I became an ophthalmology registrar at the Royal Victorian Eye and Ear Hospital. By chance, I asked Fred Hollows if I could join him on a weekend-long trip to Bourke in New South Wales. I did not know that he was about to start an ambitious national program that examined Aboriginal people right across Australia, or that I would spend the next year and a half as his assistant director. This really opened my eyes, if you'll excuse the pun, to the huge disparity faced by Aboriginal Australians. It also introduced me to the power of public health and revealed a very different level of care from that we were used to in Melbourne. I then went to Johns Hopkins University in the US for a 1-year fellowship. I became immersed in a number of research projects. I joined the faculty and ended up staying for nearly 14 years. I returned to Melbourne in 1990 as the Professor of Ophthalmology based at the Eye and Ear Hospital, established the Centre for Eye Research Australia, and then in 2008 moved to the Melbourne School of Population and Global Health to work on Aboriginal eye health and how to close the gap for vision. Now you may well ask, why am I telling you all this? I'd like to share with you 4 quotes that have helped guide me through my career, that has included clinical work, public health, teaching and research. My career has been both challenging and rewarding, and I hope the quotations will be as helpful for you as they have been for me. The first comes from Louis Pasteur, whose discovery of bacteria laid the basis for so much of modern medicine. He said, "Chance favours the prepared mind." So often new insight comes from unexpected quarters or chance conversations that open up new pathways, but you have to be ready to seize the opportunity. One example for me was a chance conversation at Johns Hopkins that led to 10 years' work in Africa and the development of a new drug to stop people going blind from river blindness. Now, each year, more than 120 million people receive this drug for free. My second quote comes from Sir Peter Medawar, who shared the 1960 Nobel Prize for Medicine with Melbourne's Macfarlane Burnet. Medawar said, "Dull and piffling problems will leave dull and piffling answers. A problem must be such that it matters what the answer is, to science generally or to mankind." There are so many things that you can work on that you must assess whether a project is really important and whether your time is going to be well spent. But if you are doing something worthwhile, it will almost certainly be bigger than you can handle on your own. The third quote comes from Robert Woodruff. At the young age of 23, he joined his father's small soft drink company in Atlanta, Georgia. When he retired, 61 years later, having been chairman of the company for decades, Coca-Cola was known around the world. He said, "There is no limit to what a man can do," and I'm sure he meant a man or a woman. "There is no limit to what a man can do if he does not care who takes the credit. Working with teams greatly enhances what can be done, but you must make sure that your collaborators and partners are having as much fun as you are and that they share in the recognition. If the job gets done or the problem is solved, it doesn't matter if your own personal brilliance is not up there in lights. By building consensus and bringing people together, one can change the world." Finally, a quote from Helen Keller, who grew up a blind and deaf child in the Deep South at the end of the American Civil War. She said, "I am only one, but still I am one. I cannot do everything, but I can do something. And because I cannot do everything, I will not refuse to do the something I can do." There are many huge problems and issues that need to be addressed in our Aboriginal and Torres Strait Islander people and our relationship with them. One person cannot solve all these issues, but I do know something about eye disease, and we can and we are making a difference there. So I encourage you all to be empowered. Seize the opportunity, have a go, start the ball rolling, and encourage others to join with you and help. To repeat the four quotes, chance favours the prepared mind. Dull and piffling problems will yield dull and piffling answers. A problem must be such that it matters what the answer is, to science generally or to mankind. There is no limit to what a man or a woman can do if they do not care who takes the credit. And finally, I am only one, but still I am one. I cannot do everything, but still I can do something. And because I cannot do everything, I will not refuse to do the something I can do. So let me repeat my congratulations to each and every one of you on your fine achievements and on your graduation today. I wish you every success in your chosen career, and I hope that these wise words that I have quoted can be as much help to you as they have been to me. And finally, may I remind you that this week 2 Melbourne graduates from this faculty received the Nobel Peace Prize. You too can achieve great things. Thank you.